It's your life, it's your heart. Smarter Heart University, your institution for higher heart learning without the confusion, where everyone can get a passing grade in life. Attend Smarter Heart University with Dr. Scott on AM 970, The Apple.
Good morning. This is your Smarter Heart University. I'm your host, Dr. Scott, and along with me, as usual, is my partner at Change of Heart Cardiology in Monmouth and Ocean Counties at the beautiful Jersey Shore, now the co-director of the endovascular program, which is, of course, perfect for today's topic, at Central State Medical Center regarding peripheral vascular disease. Well, the last 2 weeks, well, that's new. That's a new one on me. I haven't heard that before.
More Dr. Scott and Smarter Heart University is on the way on AM 970, The Apple.
Well, let's try that again.
I don't know if we're on the air or not, but we'll keep on going. Well, the last 2 weeks were certainly filled with a lot of information, don't you think?
I think that whirlwind tour the last couple of weeks.
And I have to tell you how happy I am, and you and I were driving down today, how happy that we are when we go on to www.smarterheartuniversity.com and we see at least 4 or 5 people every time we sign on listening to one of our now posted 16 shows. And folks, by the time we reach about 35, as far as I can see, we will have covered at least every common question that comes up at every visit to a primary doctor or a cardiologist. And it's interesting because now we posted on our Facebook page, you know, to ask all of you out there of topics, future topics that you would like us to develop for you. And we're starting to get some answers and some suggestions. And again, that's just going to add to the mix from that standpoint. Well, this library, as I hope we can call it at some point, will basically serve for all of you as an online go-to guide for, as we say at the beginning of every show, higher heart learning without the confusion. That's what our purpose in life is. I am very excited about this week's topic. So let's go right to our popular question that we usually do. We start, although we didn't do it the last 2 weeks. I'm having cramping in my legs. Should I be worried about this? The answer is, it may surprise you, and it is yes, if you fulfill certain characteristics, if you will, that we're going to detail fully this hour. More important is what the consequences of the diagnosis of peripheral arterial disease, otherwise known as PAD, for the rest of the show. How many of you out there think that if we find a blockage in one of the arteries of your legs, the worst thing that can happen to you is that leg could be amputated? Would it even surprise you to know that the chances of a heart attack or a stroke with that very same blockage are so much more categorically higher, with only the slimmest chances that you could lose your limb? This is what we will show you today. Were you aware, anybody out there, that there's a large percentage of primary doctors and specialists just like us that still don't know the significance of having peripheral arterial disease? And how about this? How about treating it once it's diagnosed? Again, there's a major shortcoming. All of it's very true. So we're off. Peripheral arterial disease, or PAD, commonly occurs from accumulation of plaque and debris in your aorta at the bottom and after your belly and your lower extremity arteries, and generally forms in response to the same darn risk factors that cause heart disease and stroke. By 2000, PAD was present in 4% or 5 million adults over the age of 40 in the United States. Greater than 15% if they were over 60, and greater than 35% if they're older than 70 years of age. Startling fact as of 10 years ago, and I can bet you it's more, the percentage is much, much more, as we're starting to be able to diagnose this better. The important point, if anything, that all of you should take home today and forever is, if you have a blockage in your leg, there is a 60%, count them, 60% chance that you will have blockages in your heart or your brain, at least. Not only that, but a large registry established that this 60% risk of having this disease leads to the highest rate of dying from any cause, dying from a heart attack or dying from a stroke. So if you're at high risk for PAD, you should be screened. We're going to get to that extensively. So who is high risk? Well, smoking is the worst. It increases your risk of PAD 6 times, and your risk triples if you continue to smoke even after a doctor such as Dr. Kaiser does an endovascular technique or a vascular surgeon fixes you. Your progression gets worse, so stop smoking. We say this with stents when we put them in the heart. It's the same thing, folks, with your neck and your legs. Diabetes increases 2 to 4 times your PAD risk. High blood pressure or high cholesterol doubles your risk. Surprisingly, I was going to use this for a pop quiz, but surprisingly, being obese or overweight does not increase your risk. That's a fact. So how do you know if what you're feeling is PAD? Well, this is a big part of this first section here, folks. Claudication. Claudication. That's our Mr. Rogers word for today. This is taken from the Latin word claudicare, or to limp. Did you know that?
I didn't.
Claudication is described as pain and cramping and discomfort in your hips, your backside, your thigh, your calf, or your feet with activity that's relieved with rest. That's claudication. Guess what? This only occurs in less than a third, less than 30% of people with PAD. 70% don't have it. And many patients and many doctors dismiss symptoms, and even these symptoms that we just discussed, as aging or other ailments such as degenerative disc disease or osteoarthritis or even chronic venous insufficiency in the legs. Further questioning of those 3 ailments can usually remove the diagnosis of them from the playing field, so to speak, and level it and put you down towards a PAD diagnosis. Many patients often do not even tell their doctors of their symptoms, and many doctors do not ask of these symptoms. What Dr. Kaiser and I have in our office is great, because we were provided by one of the companies of a wonderful poster that's framed and says, you may have PAD if you have this. And we've recreated that during our discussion here, so you can get your pencils handy at the end and take notes on what to look for a PAD. How about a decrease in your usual walking distance? How about if you just walk less? How about if you lose hair on your legs? How about if you have atrophy or some weakening of your calf muscles? All of these are clues to the underlying diagnosis of PAD. So here's a startling fact. PAD treatment costs 5% more yearly than treating heart disease in terms of overall costs. And so treating heart disease, PAD is more expensive, costs more to fix, and this adds up to about $4 million a year. Fact. Okay? PAD is so underdiagnosed, and 75% of you are unaware that PAD increases your risk of heart attack and stroke risk. Even worse, 85 to 90% of the PAD cases would be missed if your physician solely relied on your presenting with the typical symptoms of claudication. So as we go to break, remember this, folks. If the eyes are the windows into the soul, then the legs are the windows into your heart. Vascular disease is a head-to-toe phenomena, and we will show you today that a preventative strategy is the best in terms of diagnosing, preventing, and treating PAD. That's my introduction.
Well, that's a great introduction. When we're dealing with PAD, I always tell my patients, you know, vascular disease, or all these blockages that we're talking about, is systemic. It's affecting every artery in your body. It's just, where does it show up first? And a lot of times it shows up in the legs first, and people don't think of that. Oh, I've got arthritis, I've got back problems. It may be blockages in the legs, and unless you're specifically complaining of that to your doctor is savvy enough to have that as a general question that they ask. All you have to do is ask, does it hurt when you walk? And you can get more, identify this disease. And I always tell, yeah, the worst case scenario is that you lose a leg. Well, you know, that's bad, but you're still alive. The leg arteries, that's not what's going to kill you. It's the heart attack that goes with it, which is why as cardiologists, as a vascular cardiologist, I like to say, we have a little leg up on, pardon the pun, a little leg up on maybe other docs in that we focus on the heart and the lungs. This